the world, and Janet being one of them. She worked up until the last moment of where you see her in the scene.
Jill, why do women remain victims in this kind of environment? Is it an economic thing, an economic empowerment issue, or a political empowerment issue?
It's probably some of both. I think that people don't really recognize the important role women do play in the economic life of not just the family but the country. But what we've struggled with for decades is the political will issue. It simply hasn't been there. And honestly, when we talked about social justice issues, we got a lot of sympathy but not a lot of action. And so once we began to talk about the economic implications of all these women dying, both the cost to the health system but the cost to the economy, things began to change.
Christy, I'm going to put an email to you if I can. It came in from Uganda. It touches on a key factor, which is, it's the role of men. And Arthur Musasizi in Kampala in Uganda wrote in saying, "Without mothers, this world would not exist. We as men have a collective responsibility to respect women and give them the necessary support they need to bring up a new generation that will inherit this world when we are long gone." I wonder how much, or is there enough effort made to bring men on board with trying to resolve this issue?
I think men are absolutely a piece of the solution to this. I've seen in many, many countries amazing community-based programs where they invite the men in and where religious leaders in their communities take this on. They're educated and then they become the voice of the community to help bring men and families around this issue. It can be incredibly, incredibly impactful. I mean, in our film, oftentimes the men just were not there. They just weren't. And people ask me, did you try to exclude the men? And I said, no, we filmed what we saw. They just weren't there. So I think really, starting with young children to understand that both men and women, boys and girls, have a role to play in making this better.
Right. Jill, an email to you then from Bangladesh, from Aziza Haq, who says, "Raising women's status in the family and society is most important to safeguard them from premature death, either from pregnancy or any other social injustice. What can be done to raise their status in the family?"
It's tied to raising their status, period, recognizing the values they bring. It's one of the reasons we have just published our Women Deliver 100 list, because it was trying to elevate, to give real visibility to people who are doing things that help girls and women. And it's just an important opportunity to take the 100th anniversary of International Women's Day to focus on how important, how integral women are to the life of our communities.
Well, Christy, talking about this issue, I wonder if you're a fan of the micro loan system that is out there and helping a lot of women in poor areas, in rural areas especially. I don't know in your travels what you saw of the impact that might have in raising the economic empowerment of women and as a result their sort of social empowerment.
I very much believe in the microfinance model, and seeing where that model can be connected to health systems, I think is key. We saw that in Bangladesh, obviously being sort of the foundation for most microfinance programs. Incredible programs where the first thing the woman does when she does have a bit of financial empowerment is to take care of the health of herself and her family. And so it's so clear that this is such a critical and important link.
It's interesting you touch on that. I put an email to you, Christy, that came in from someone who says they traveled with you in Bangladesh during your time there on the documentary, and it's Mika Ahmed from Bangladesh, who says,
"Oh,
you remember?" Okay, well, he says,
yes, I do.
Well, in a country like Bangladesh, mothers will generally choose to provide the best food to their husband and children, saving only vegetables and rice for themselves. Villagers will rarely visit a doctor until their health gets very bad. What can be done to reduce maternal mortality as a cause of poor health? And I know that level of sacrifice by mothers is incredibly touching. I know Bangladesh also has that unique problem of the pressure many women feel to have their children at home and not go out to clinics and so on. And I wonder, what was your impression of that situation and what can help make women there, pregnant women there, more safe?
Absolutely. I mean, we saw in Bangladesh in so many circumstances where, this is where almost 80% of women deliver outside of a facility. So trying to really understand why women are making that choice. And find out that actually they're not making that choice at all. Those choices are being made by others. I think seeing also how there was, just the not knowing that if you were to eat well every day, that your baby would be healthier. There was a sense that people didn't want their babies to grow too big. There was a lot of education that needed to be provided, and we saw a great program in the Manoshi program, that's a BRAC program there in Bangladesh. It's fascinating to see how different and how similar this experience is for so many women around the world. But I did find in Bangladesh to be completely in awe by the strength of the women. There were women that were actually in labor, hardcore labor, and you would not even hear a sound come out of their mouths. You just would barely see a tweak in their face to tell that they were in pain. To work around some of those kinds of issues is really important and something that I've seen successfully happen as well.
Jill, I'm going to put an email to you from Bangladesh, if I may. This came in from Abu Saleh in Didar, who says the best way to reduce maternity deaths is to spread awareness and educate people. We should be training people from every area in midwifery and allow them to train others. This way, the potential of knowledge is exponential. And I wonder how much that kind of education focus can help, especially a targeted campaign. Is there really any effort to do that?
There's huge effort to do that because, frankly, that's one of the huge missing links, are trained providers to help women both through pregnancy and labor and delivery. But the other piece of it is really important, Riz, and it has to do with educating girls. It's one of the most important investments governments and families can make, because when you educate a girl, good things follow. Infant mortality goes down, maternal mortality goes down, family nutrition goes up, incomes go up. They're just only positives to making sure girls have education.
Christy, in your travels, how hard did you find it to overcome cultural barriers in some places where I guess perhaps there are women reluctant to change certain habits and environments because they feel it's outside interference coming in? They might see someone coming from the West and it's not someone they can relate to.
Well, it's interesting. I think oftentimes the cultural barriers, people are afraid of how to get through them, how to break through them, so they tend to sort of lump them in an area over there. Like, we can't deal with that because it's cultural. Some of them are so simple that I think the education piece is a huge part of it. And like, an example is a cultural barrier could be described as something as simple as a woman not wanting to have a male physician deliver her baby. I'd say that most women would prefer a female practitioner when they're having their baby. Most women feel more comfortable with a female doctor or midwife. So that's something that is, it's so simple how people would sort of take something like that and set it aside, and it's not really it's not something that's different to any one culture or the other.
Well, Christy, let's take another look at your documentary then, No Woman, No Cry. And during that time in Guatemala, you documented the lack of access to safe and effective contraception and the alarming number of women who died due to illegal abortion. Let's take a look at this scene from your film.
Adolfa, ¿y usted quería estar embarazada ahora esta última vez?
Ya no.
Ya no quería estar embarazada.
Ya no.
So here's a young woman who didn't want to get pregnant, and I guess there the issue of religion is a big factor. And I wonder to what degree that presented a challenge with trying to